Good morning, everybody. I'd like to start by acknowledging the Ngunnawal people who are the traditional custodians of the land on which we gather today and pay my respects to their elders past and present. I extend that respect to Aboriginal and Torres Strait Islanders peoples here today. Welcome to our 12th webinar. As usual, we have someone in the team who's off at the moment, so unfortunately Jasmine Hyatt can't join us today, but Gary and I will cover the content that Jasmine was planning to. So for anyone who, if this is perhaps your first webinar, I'm Michelle Van Veek. I am the lead for UDI implementation at the TGA, and Gary Pascoe is our technical lead for the UDI database and other things. So we have had a number of questions over the last few webinars and in relation particularly to the Sandpit and the consultation. So really what we want to do today is provide answers to some of those questions that we've been asked but we haven't been able to address in a webinar, for example. Give some update on where the Sandpit's up to and the consultation paper. And then hopefully we'll have some time at the end for more of those questions. We know there's a lot of questions at the moment, so trying to really take some time today to focus on those. So some of the questions we've got today, we've put answers here for anyone who can't attend the webinar and just looks at the slide, but I'm going to talk them through. And so one of the questions has been, if I can't attend a live event due to the time differences, so we know Europe in particular is particularly difficult for some of the time zones, will the webinar recording or slides be available after the event? And so the answer is yes, they're all available on the TGA UDI hub. And so for every webinar, it will be the slide presentation, the recorded webinar, and a transcript if needed. So they're available on the hub. So all of the past ones are on there as well. Another question around the registration for the Sandpit. So if I've submitted to my registration to use the Sandpit, when will I get access? So when we opened up the Sandpit, we really looked at what would be useful in terms of use, and for any organisations that might want to use the data, if they get access on the first day and there's no data, we didn't think that would be an effective use of everyone's time. So we've had two phases. The first phase is to get some data into the system, and the second then is for users to actually access that data and see what's there. So while you might have registered, we might not have actually provided access just yet, and we're also managing the numbers. We've been really, really pleased with the number of the interest and the number of registrations, and we just want to make sure that all of our teams can manage that access appropriately so that we can manage the feedback as it comes in and manage the registrations. If for any reason you've registered and you think we might not have received it, please email us, udi@health.gov.au. And if you haven't registered, we'll give you the link to register as well. We have a registration of interest there. So definitely looking for anyone who hasn't registered and would like to get access, please register with us. Another comment around the UDI hub perhaps not being quite up to date and how could we share information. So the TGA is actually in the process of launching a new website, and over August and September in particular, there will be some work to bring the hub up to date in line with those website changes. But specifically in the meantime, if there's something that's not published or you can't see that you'd like us to send to you directly, just send us an email and we will do that for you. Some more questions and answers, and a lot of these are related to the alignment of the Australian UDI to the EU, the IMDRF and other countries. So the first one is, will the TGA UDI database be aligned with the Udamed database? And there's a little bit of difference between the EU database and the Australian situation in terms of the data we already collect. So Udamed is now being developed to support all of the EU medical device and in vitro diagnostic device regulations. So it's a very large, complex system. we already have in Australia the Australian Register of Therapeutic Goods, and that's got information on medical devices authorised for supply in Australia. That's been in place for many years. So what we're doing in Australia is we're creating a second database. So our Australian UDI database will only contain the UDI data. It won't contain all of the other device data. So there'll be two sources of device data. And we note that we're still working through the data elements as part of the regulatory framework and the feedback on the database and its use. And they may differ from Udamed. And we know some of those are still emerging from an EU perspective as well. So the next question is, can you provide more information on how Australia rules different from the EU, USA, Canada, other countries? So really our plan is to align where feasible with the IMDRF Forum Guidance and Application Guide and the US and the EU. So we know in some cases the requirements differ between those, and the Australian government will be responsible for deciding the Australian UDI regulations. So that is the role of the government here. We don't plan to publish anything that covers all of the similarities and differences across Australia and the other countries. That would be a really large piece of work. So the next question is how closely we'll be aligned with the IMDRF. So we've noted that we will be, in principle aligned with the IMDRF, but we note there are some additional differences, for example, between the EU and the IMDRF requirements, such as the requirement for a basic UDI, DI, and master UDI that are in EU that aren't in the IMDRF guidance. Next question is, when will we publish the Australian UDI Data Dictionary? So we plan to publish the draft data dictionary as part of our third consultation, which I'll talk about a little bit later on this morning. And we'll publish a version on the TGA UDI Hub at that time. So the final data requirements will be part of the regulations, and then we'll publish a final version once the regulations are decided by government. And we'll put that information on our hub because that will form the basis of the data that needs to be provided to us. Some more questions. Will plasma and blood products be included on the Australian UDID? So through the third consultation, we're seeking feedback as to the scope of the regulatory framework, what should be exempt from UDI requirements. So we really appreciate when that's published any feedback around that. Proposed timeline for the Australian UDI implementation. So our indicative timelines are voluntary compliance for high-risk devices from January 2023, and then from July 2024, mandatory compliance for implantable devices, and that covers allocation of UDIs, UDIs on labelling or the device itself, and provision of data to the regulator. And we're seeking feedback on those timeframes in more detail as part of the consultation paper as well. And the next question is, when can we expect the third consultation? I've mentioned it a lot, I know, in these other questions, and we're planning to release it in August. And so we'll notify all of our stakeholders that are on our UDI list or sponsors who are currently active using our systems, to let them know that it's been published, and we'll put more information on the TGA website around that as well. So that is very close to being finalised and published. I'm going to now hand over to Gary to answer some more of these Sandpit sort of more technical specific questions. So over to you, Gary.
Thanks, Michelle. So good morning, good afternoon, good evening, everybody. As you probably know, many of you know, I'm Gary Pascoe. We're responsible for the development of the UDI database, and by virtue of that, a number of the technical questions that people have asked, I'll cover. I do note that there is a couple of these questions also may address some of the questions that have come through in Slido, so hopefully I can cover those as well. But we do have the opportunity, so still please keep using Slido to raise these questions. I think we'll have a reasonable amount of time today to cover the questions that have come up through Slido. So hopefully if I don't address anything specifically that you're looking for, feel free to raise that in Slido and then we'll come back to it at the end of the session. So the first question is, is the data entered into Sandpit only available to the data owner or can all users view it? So essentially the Sampit version was being built on the principle of all UDI data will be accessible and viewable for all users. So whether you're a manufacturer, sponsor, or any other user from wanting to view and just search for the UDI data. So all of that will be accessible once it's been published. So the database itself has a capability for a manufacturer, sponsor to add and update a UDI record. They can continue to draft that until they're ready for it to be published. And once they've published that record, they explicitly take that option. And then once that record has been published, then it's viewable to any other user. The manufacturer and sponsor will have only the ability to create and amend records associated with their UDIs, but certainly anybody will be able to view it. And so all records you'll see in Sandpit to date have been created by manufacturers and sponsors and have been set as published by them as part of that sort of the validation process they've been working through. Is the second question, is the Sandpit pre-populated with database from an overseas database? At this stage, no. It is something we have had considered when we walked into Sandpit. We started with Sandpit as a blank database and used that as an opportunity for manufacturers and sponsors to enter their data in so that they can test it and trial it from perspective of having a blank database and starting from that perspective. It is something that we are now talking to selected manufacturers and sponsors we are getting some users who are interested in saying, well, I'd like to have a select set of devices in the Sandpit and use that for viewing from a registry or from a hospital to healthcare provider perspective. So we are looking at the sort of considerations with manufacturers and sponsors to add specific devices, but at this stage, there hasn't been any decision and we're just using manufacturers and sponsors. We want to test the flow right from a manufacturer and sponsor through the various channels to get the data in the database rather than us artificially adding stuff in there. The third question, so can more than 2 people have access? And if so, can this be done later? Absolutely. So there is no limit to the number of users who can access Sandpit, and we have a number of organisations who have registered up to 10 people from their organisation. And so we're actively and openly encouraging as many as you would like to be able to use Sandpit. The unfortunate thing is the registration form does limit you to the number of users, so to 2 users per form. That was a bit of a sort of an issue with the form process that we have. But certainly, if you do want to register more than 2, we'd like you to register 2 on one form, go back and re-register, create a new form, and then add multiple registrations to cover the numbers of people. But certainly, there's no limits for the number of people you can register from your organisation. And similarly, we'll continue to keep the registration process open for the entire Sandpit period. So running from now through to the December period, when we're looking for voluntary compliance to go live, we'll be keeping that registration process over. So there will be no end date or no stoppage to that. The fourth question, will the production environment allow for multiple records per bulk upload spreadsheet? It is something that we are looking at, and we've had quite probably the most area of feedback we've had to date in Sandpit is around the bulk upload functionality. And I see there was some just quickly some questions around that similarly raised in the Slido questions that just came up. So it is an area that we've looked at. We did go, scroll back at me. Sorry, there was, we've had extensive feedback, and those of you who may not know, there is the ability to upload UDI records. However, at the moment, it limits 1 file for 1 UDI record. And we took that design decision from a perspective of making it simpler and easier in providing validations around the data to be uploaded. There has been quite extensive feedback from a number of stakeholders saying, we'd like to have a look at this and we'd like to see if we can get multiple records per Excel spreadsheet and have one spreadsheet covers multiple UDI records. We've captured that feedback. We're actually looking at some, the design and the process for actually uploading at the moment. And so we're taking your feedback and we'll be coming back out to the various stakeholder groups and looking through what the options are in terms of uploading data differently through the bulk upload. So I can't sort of really talk a bit specifically about, well, it won't be at the moment, but certainly it's an area that we're looking for strong feedback, and we'll hopefully put some suggestions in the next couple of weeks around options for how that can be improved, and be seeking your feedback in relation to the the merits or the pros and cons of each of those methods. So moving on to the next slide. Maybe. There's a question that was related to the bulk upload as well, so which we thought was a very good one, and one that we would like to take on board was, can the bulk upload template be provided online for allowing users to prepare ahead of time before they gain access to the Sandpit? Yeah, so the first one is, thank you for that suggestion, and it's not something we had thought of, but we're definitely looking at, as part of that bulk upload process, what's the best method to provide that template so that you can actually pre-populate some of that information before you get access to Sandpit. Those who have access to Sandpit to date, there is the ability to download the template already, and so you can use that template as then a guide for creating your UDI records, noting that it is something that is under review per my comments just before the previous question. Next question, will the Australian basic UDI follow the same attribute requirements of the EU? It looks optional in the spreadsheet. Is this the plan for basic UDI? So as we sort of publish the data dictionary and the bulk upload template to reflect a range of options that are being considered as part of the consultation paper, we've included the basic UDI DI, and that has been included in the Sandpit as optional. So the bulk upload template caters for it. It is an optional requirement. However, noting that the requirements and the use of basic UDI and some of those other data elements will be covered as part of the consultation paper number 3, and that Michelle's already mentioned. And we'll be looking to some feedback from stakeholders in terms of the merits from a basic UDI DI perspective. And once we've received that feedback, that will feed into the decision by the Australian government to sort of look at what the final regulations and the final data elements. Next question, will the Sandpit data be scrubbed when the AusUDI goes live? Yes, it will. The data in Sandpit is only being seen as test data, and it will be something that is using for validation and assessment of the Sandpit. So we're not seeing that as being data that would be supplied by manufacturers and sponsors from a final data set. So that will be required for voluntary compliance, and the voluntary compliance, once we go live, will be a blank database, and we'll look for manufacturers and sponsors to populate that information right from day one. So we are looking for different device information, but all of that will be cleaned out before we go live. A final question on this page, will the TGA be issuing guidance documents to help Sandpit users on testing protocols? We haven't really prepared anything, but we are preparing some simple guidelines on organisations who are looking to use machine-to-machine in the National Product Catalogue for data exchange, because there are some specific provisions around, or specific considerations we'd like to take into account for machine-to-machine and PC data exchange, and that's largely around ensuring that we've not overwhelmed with the amount of records and the numbers of records, and if a sponsor or manufacturer chooses to send 10,000 records to us at once, it may be something that we'd like to sort of manage and keep that done in a more progressive and evolutionary manner. So we haven't really planned to issue anything around the use of the application itself or the online entry of records, but if people feel that is necessary, and we're sort of taking the view that it is a reasonably intuitive and simple process, but if you do feel that's necessary, please give us that feedback, and we would look at publishing something. But we have started sending out some information around the machine-to-machine and PC data exchange. Moving on to the next slide. So really just wanted to use this as a placeholder to just reiterate, we do have the Slido question and answers open, so please feel free to use that. If there is anything else that you'd like to ask questions, our engagement operations team, it can be contacted on udi@health.gov.au. The team is always looking forward to hearing from you, and in terms of feedback, positive or negative, or questions around how things are going. We'd also like to have any feedback from Sampit or on the webinars. And I know some of you are already starting to use the feedback buttons that are in the Sandpit version. And we take that information and using that to start feeding into the refinements and the evolutions that we have around the Sampit versions, but also then feeding into the design for the final apps, the development of the Art database. So just would like to sort of reiterate, please feel free to send all feedback and thoughts and comments through to the database. And I'd like to thank those of you who have done that to date. We've had some really good feedback and some great suggestions. So we'd love to see those keep coming. Thank you. Just final I finished the questions and answers that came up the last July webinar. I thought I might give you a little quick update on the Sandpit as well. And just as of the 6th of August, we've it's moved on a little bit, but we've had 250 registrations, which really has been quite a mix of organisations and individuals. Most of those, about 70%, are from sponsor and manufacturer organisations, although it is a increasing number of people who are interested in Sandpit, either software providers who are acting on behalf of a sponsor or manufacturer, or healthcare professionals are now starting to say, how can I use this UDI data, and how could that then support some of the downstream processes from the healthcare? So we are getting continue getting interest and registrations, and we have 141 registered users on the 6th of August that has been created and added to the database. We now have about 167 of those accessing, and that number of saying this morning, that number is far greater than those who are still registered or waiting for access. So we are now sort of closing out all of the final registrations. As Michelle talked about, we're having a managed approach, but essentially we're looking to close out all those registrations now in the coming week. We have a small number of UDI records created, so it represents, just say, about 45 different sponsor manufacturer organisations. A little over half of those have actually created records within the database, and so it's a small number, and we expect to see that number growing now that we're starting to open up the machine-to-machine and the NPC data provision, and essentially seeing greater numbers of records start to come. So it's been good. It's been great in terms of getting the feedback and seeing people using it. Feedback has ranged from thoughts around how we can change the look and feel, how we can actually better collate the information for particular devices or attributes of a device together, so it better suits the support process, the business process for how manufacturers and sponsors work, through to improvements with the bulk upload that I've just talked about before. We've had 69 calls and 159 emails, so the team is working really well, and we're making an effort at this stage to respond quickly and in a timely manner to all the calls. So they find enjoying the conversations and engagement with the various people who are calling and emailing. We've actually released a couple of updates to the database, and there's another one which is imminent. So since over the last 6 weeks, we've made 2 updates. We're looking to roll those out every couple of weeks to make some changes to errors. We've simplified the login process and made it easier for those of you to create your accounts, introduce a number of enhancements, as well as then starting to look at some other improvements to things like the bulk upload that we've talked about. So that will continue to happen, and we'll make that any major changes will be published, and we'll let everybody know. But there's still an ongoing sort of program of work to just take your feedback and make refinements as we're going. And that's me. So I might hand back over to you, Michelle. Again, I would just like to stress we do have we'll have a little bit of time, so please feel free to raise any questions in Slido, and we'll look to get to those. But I'll hand back to you, Michelle.
Thank you so much, Gary, and great to get that update on the Sandpit. So we'll just move forward, please, if someone can move the slides forward. Thank you. So we've been working hard on Consultation Paper 3, and really the purpose of it is going to be to get detailed feedback to help provide information to government around what the regulations need to be to support the operational side of UDI. So we already made the Act changes that we needed to, or the government did, and then we're going to finalise the regulations. So really, the focus areas are likely to include: should Australia accept EU and US FDA compliant labels and data? So what might the implications of that be? The scope of devices and exemptions. So what is in scope? Should, for example, class 1 be in scope or not? How do we align with the scope and exemptions across other countries? Phased implementation approach, and I've seen there's been some questions in Slido as well around the Udamed terms, but really what should that transition, that implementation look like in terms of risk classes? Who should provide and maintain the data? So that a lot of the work around the Sandpit is helping to inform some of them, but really seeking some information on the role that we have as a sponsor versus the manufacturer, and what's going to be it's going to minimise the regulatory burden there. Labelling, so some feedback on the labelling. From July 2024, UDI will need to be included in the TGA fees and charges, and so seeking some feedback around that. And then considerations for adoption and use. So a lot of our focus is on the provision of data, but we need to also seek feedback on the adoption and use of UDI in hospital systems, in clinical quality registries, for example. So we'll give you a minute now. We're up to questions and answers. I see things coming through in Slido. So we'll just pause for a minute and ask you to do the live poll, and then we'll come back with questions in Slido. So we'll have about half an hour for those. If you notice, there's Hannah in our team has been also adding things in that have been fed back to us in terms of questions, but we'll go through and start to address those in a minute. Back to you, Nishi. Thank you.
Thank you, Michelle. Just wanted to remind everyone that you can find your Slido tool if you want to ask questions on the bottom right of your screen to the Apps Plus icon, just like it's shown on this slide here. And you can use a QR code and the link we sent through before to access off your computer or your mobile phone. Until Michelle and Gary look through the questions, we also have we'll be opening up our live poll right now, which I'm clicking on, which you can use to answer or provide all your feedback about the webinar today. It should open up on the right-hand side of your screen, right next to the Q&A of Slido. All right. Beautiful. Yeah. So while you are providing your feedback and Michelle's going through all the questions and Gary is too, we will also send through some links to our social media pages and also to the UDI pages, resource pages. So you can save them up on your computers and use them to review later on.
Okay, so I'm happy to, we'll go through Slido now and we will start to address some of the questions. Some are a bit more technical, some are around the timing. So what I will do is I'll read them out and either Gary or I will address those as we need to. So I will start really at the top with how will the TGA transition and implementation timelines be affected by the 1-year delay of UDI Udamed, which is the database in Europe? Look, it's a really, really good question. And we see that also in the US, some of the timings around the transition are being delayed. So we're seeking feedback on that in the consultation paper in terms of, you know, what should our implementation timelines be and how might that be impacted with other countries and manufacturers also managing UDI across multiple countries. So just that is the plan there. We have another question which we will definitely switch to because I know we've had a lot of questions around this. So Gary, this one's going to be for you around the bulk upload. So the question is, the current bulk upload feature in the Sandpit requires one entry per file. Will the change in the final version of the UDI platform allow a true bulk upload based on the spreadsheets? I believe this question is relating to, rather than the machine to machine.
Yeah, thanks, Michelle. I sort of read that note. I also see it's that question has been asked, and there's been 11 people have also voted for it as well. So it's again sort of coming back to that point. It is something that we are looking at as part of the revisions to the bulk upload, and we've had strong feedback to say similar comments. So I don't know what the sort of final answer is, but we'll be taking those sort of couple of options, bringing it to our technical working group and others. From a stakeholder perspective, to be able to look at those options. We actually had, interestingly enough, we've had some people say they like the single file upload as well. So it is sort of a bit of that tension to ensure we get it right. But it is something that we are definitely looking at. And whatever we do in terms of making the change, it will be done before we go live, so that we ensure that we have something that everybody knows about, and we have settled around the reflections to the what comes out of the regulations to make sure that that's right. Thanks, Michelle.
Great. Okay, thank you. Next question. Should we expect all medical devices, e.g. low-risk devices, will be covered as part of UDI? So great. It's a really great question, and one we will be seeking feedback on through the consultation paper, because we know there are challenges around low-risk, high-volume devices like contact lenses. We know that there are some different regulations in the US around devices that are sold over the counter and may not be used in a hospital setting, for example, because they already have a universal product code to actually provide an identifier for those devices. So we would really appreciate everybody's time to respond to us in the consultation paper, to give us that information that will be considered as part of the regulations. And similarly for the next question, is there an expected timeline for class 1 and 2 UDI? So that is the same as part of the consultation paper. We will be seeking feedback. So we have a proposed timeline in that consultation paper to help focus the conversation and for that feedback. So it's part of that process. I'll take the next one, and actually I'll take the next two, Gary, and then we'll see what's from there. So how is the Sandpit different from the FDA Good ID and the EU Udamed? It's a really good question. So the Sandpit is something that we have built specifically based on feedback from other country implementations. And the idea of the Sandpit is that it will continue on in parallel with our UDI database. So it will be a permanent place that will have test data. It will allow training. It will allow connection of machine to machine and testing of those connections before a move into production. So we've got good feedback that having something like that continues on will be useful. So what we'll do is we'll have, when we next year, we'll have a live version, and then we'll have our Sandpit that will continue as well. So that's different in terms of Good ID and Udamed. In terms of data published, most of the data from the final production Australian UDID will be published. The next question is from somebody who has a question around which nomenclature is Australia using, GMDN or the European Medical Device Nomenclature. So the GMDN is our standard nomenclature across our regulatory frameworks and not just for UDI. So UDI will be, GMDN, Global Medical Device Nomenclature, will be mandatory for UDI. And we've had feedback that collecting additional data, if it's not mandatory, may place additional burden on manufacturers and sponsors. So unless we get feedback to the contrary, we're not proposing to store EMDN for those devices as well. Gary, this one I'm going to hand over to you. So when submitting feedback, can we use email instead of the feedback button? When using email, I can provide more detail with screenshot or file attachments.
Thanks, Michelle. So short answer is absolutely. We were happy either way. The concepts behind the feedback button was really to be able to say, if somebody was in a particular screen and there was something top of mind that they felt that at that time, and expect it to be fairly simple and straightforward and concise, use the feedback button. However, we really like the emails and being able to, we had a number of areas we've had feedback and screenshots and articulation of the issues that we've experienced or you have experienced have become really helpful through more of a sort of a bigger email. So absolutely, it doesn't matter either way. And if email suits you and that makes a lot more sense, then feel free to do that. And the team gets to those irregularly, so we capture that and collate it all. So absolutely is not a problem.
Great, and I'll have another one for you here as well. Will the TGA provide an API, an application programming interface, for the UDI database to access UDI data for reading?
No, at this stage for Sampit, we don't have that on the radar. So we do have the ability to download data in a JSON format, so somebody can take it now and use it and load it into a systems. It is something that is on our roadmap to sort of consider as part of sort of evolution of the database and how it then progresses into the ability to use an API. And we'll be planning to do some more work and understanding them in terms of the attributes of the API, the frequency of data access and real time versus sort of more batch processes. So there is some work we have to do, but certainly for Sampit, it's not on our radar at this point in time.
Okay, thank you. And perhaps I'll pass this one to you as well. Will UDI link to the Artg and other lists such as the Prosthesis list, recalls, or adverse events register?
Yes, so I'll cover each one of those separately. So when somebody, a manufacturer or sponsor, creates a UDI record, we provide the provision to link and provide the Artg ID for that particular device. And by doing that, then the application will then provide a link through to the public summary from the Artg for that particular device or for the Artg entry that has been provided. So absolutely, it does do that. We are looking at, because it's standalone at the moment, we aren't able to, so the UDI Sampit sits outside of the health environment and therefore doesn't really have a lot of access to some of the health data around Artg. We are looking to move that into and enrich that capability. But essentially, you'll be able to link through and see the public summary at this stage. And then we'll continue to have that and look at how we can evolve that once we move into health. Prosthesis lists, recalls, adverse events is definitely something that we're looking at and how we can add that to the information within the UDI database. Obviously, the challenge is there may be multiple devices related to one Artg entry, maybe multiple devices related to a recall or the prosthesis list. So working through those particular provisions at the moment, but certainly it's something that we've been talking about and looking at how we can make that work. But Artg is definitely on that on the plans and currently does that in Sampit today.
Great, thank you. We've got a couple around more about the scope of devices and some of the data, so I'll take a couple of those. Is it confirmed that only devices on the Artg will need to be on the UDI database? For example, unapproved or special access scheme, for example, will they be included? It's a really good question, and it's one that is in the scope of the consultation paper. So exactly to say which devices, which risk class, which in vitro diagnostics, and for things like export only or special access scheme devices, will those be included? So I really appreciate feedback on those. What is the intention of the optional basic UDI DI field? So I think we've covered that. So it was really to look at what might be useful, again, subject to the final decisions of government around which data that we will keep. I'm just scrolling down through here. And again, I think this question is along the same lines. Will TGA follow the master UDI concept for contact lenses that's being developed in Udamed? will private label products require a UDI-DI for the same device? So they're things that we're currently going to be consulting on. Some questions, another question around the Sandpit, so a couple more for you, Gary. How can we communicate our observations from the Sandpit? We've noticed some oddities and bugs when using it, but in brackets, overall, it's very good. So I think, you know, one of the benefits that we have is this is a great period of 6 months to get feedback on what we've built. We really appreciate all the effort and time everyone's putting in. And so, yes, there will be some oddities and bugs and things, but the idea is that we iron those out and work through those between now and early next year. But Gary, I might pass that one over to you as well if you haven't already covered it in discussing the difference between the feedback online and the email.
Yeah, no, thanks, Michelle. And just sort of quickly, for certainly oddities and bugs, email is probably the best option. So the email address is, send it to the one we published already. You'll see it in a number of spots. It's on the Sandpit version as well, udi@health.gov.au, and the team will sort of take that and acknowledge the response of it. But for those sorts of things, we would be happy to receive that via email. And of course, we'd also welcome any positive comments as well. So feel free to send those through. It's always nice to see those as well. So, but certainly, as Michelle's already touched on, this is very much a pre-release, an early release of the database, and the design to receive your feedback and thoughts and guidance. Please feel free to send anything, even if it's something just slightly doesn't make sense to you. We would really appreciate hearing that via email.
Great. And another question is it okay to enter made-up data in the Sandpit? Some of our data is fictional and was created to test different parameters. So I'll have that to you as well.
Yes, absolutely. And from a Sandpit point of view, like I say, it's sort of testing environment, test data, and it won't be sort of progressing through to a production environment. So please feel free to do that, and whatever best suits for you to sort of test the database would be welcome.
Great. There's a question on how long we'll have for providing feedback to the consultation paper. So we will let you know when we publish that. It's still something that's being discussed as part of the approval process as well. Another question for you, Gary. When UDI database goes live, do we need to re-register? Or as we already have Sandpit access, will it be automatic?
Yes, at this stage, we may be looking at ways to do this, but we essentially, what we've done, because Sandpit is independent of the sort of the final production environment, and we have created a sort of registration and online account creation process, which is independent to the final implementation. So my headphones are just messing around for a minute there. Unfortunately, we will be asking you to sort of re-register, and we'll run a process with you as we get closer to that sort of production go live.
Okay, I'll take a couple more. So there's one question or a concern raised about using GMDN. And it notes that the one in the current business system for product registration is rather outdated. And yes, we're very much aware of that. And we have made some improvements to that, but we haven't finished that work yet. So we understand that some GMDN terms may have been revised or codes obsoleted and they aren't reflected in our current system. So the plan for UDI is that the way we manage the GMDN internally will be different, and it will be up to date and kept in line with the GMDN agency code set, which we'll download on a very, very regular basis. The other point on the GMDN was a question around GMDN is not free for all. So if you're not aware, the agency, I think in 2019, perhaps more recently than that, has actually created a new level of membership, which means that it's free access. It's a basic membership, so it doesn't include some of the higher functions, but it means there is access to all of the codes as needed with no actual cost. So another question around classes of device. So this one's around reusable surgical instruments. Again, that forms part of the scope that we will cover off as part of the consultation paper. Another one that says, if we still haven't received any response regarding access, should we follow up? How long should we wait? Please follow up. Send an email to udi@health.gov.au, and the team will make sure that we did receive the original registration and that there's not an issue in terms of not having received that and therefore not being on the list. I'm just scrolling now through the list to see if there's any more. There's one that I don't think we've covered, so I know we said we wouldn't move the data across. Perhaps, Gary, you've already covered this, but I'll just check. Since the UDI data in Sandpit will be erased when Oz UDID goes live, does this mean we need to re-upload UDI data again after the system goes live?
Yes, Michelle. So yeah, the answer is yes. As I mentioned earlier, it'll be test data or sort of made up data in the Sandpit environment. So we'll obviously clean that out and ensure it's clean and ready to go once UDI goes live. So the Sandpit itself will have a life after we have a sort of production version of the database, so that we will keep it available for people to test. There's sort of different connections as well as then play and test it themselves, but it will be a separate independent environment from the production version, and we will be looking for manufacturer sponsors to upload their UDI data from scratch once that happens.
Great. A couple of other questions. So we have a question, which is a really good one, in that what kind of support will we be providing? So will we be providing like videos and screenshots and things to help everyone? And yes, we are planning to. So as part of the work we're doing between now and January, we're looking at not only what kind of documents like user guides we need to create, but also how we can help everybody use the system easily and efficiently by creating other document and webinars and recordings. So if you've got any specific ideas or feedback about something that would work well or something that perhaps wouldn't work so well, we'd really appreciate you sharing that with us through our email is the best way. So udi@health.gov.au. There's another one here. There's some really good ideas coming through the questions. So there's a question that says, will TGA provide a checklist of tasks that the industry can use as a guide to prepare ourselves before Oz UDI goes live? That is a really good thought. So we'll take that one on notice, and we'll have a look at what we can do in the time frame and what format that might take. Because I think it's getting voted up. I'm seeing the numbers going up now straight away. So really, I think if everyone thinks that's still moving, if everyone thinks that's really going to be helpful, then it's something we can look to do. And perhaps we can work with some of the manufacturers and organizations who've already had to implement UDI because they also supply to the US or the EU, for example, around if there's anything that they found useful or not so useful. So I'm sure we can get some support on that one to provide that as well. We're looking at, as part of our adoption work, something similar for hospitals and healthcare providers to actually help them prepare and understand what they need to do. So great that we can look at perhaps doing one on it's still going up. I'm just laughing. That we can do to prepare that as well. So I'm just going to scroll through to see if there's any questions. We're close to the end of time anyway, but I'm just going through to see if there's anything that perhaps we haven't covered. So we've got a question about whether the classification in the indicative timeline covers both medical devices and in vitro diagnostics, and it's intended to. But if we need feedback to break those out, because I know the other countries have tended to break out the difference in timelines between medical devices and IVDs. And if no, when can we anticipate the requirements for IVDs? So the plan is that the requirements will all be done together. They won't be separate between IVDs and the devices. So that will happen together. We might, based on feedback, choose to phase the implementation in the way the other countries already have by risk class and then by IVD or devices. But really, again, appreciate your feedback on that as part of the consultation paper. A question that I'm not sure we can answer, so I will maybe pass it to you, Gary, in the first instance, and then we'll see. We might have to take this one on notice. Can you discuss any alignment with the current commercial requirements regarding product data in Gdsn? So actually, I'll take it, Gary. I'm not sure we can at the moment. We're obviously working through the National Product Catalogue because that is the Australian component. But we certainly appreciate any input, and we've had some discussions as part of the technical working group about whether we should have open up the ability to provide data through the global data synchronization network more broadly, and we're looking at what the demand for that might be and what the need might be. If the current commercial requirements is more in relation to, in Australia, some of the states and territories have mandated the use of the National Product Catalogue for supply and purchasing of devices. So that sits outside the TGA. They're not decisions that we would make or be involved in. So I think hopefully I got the nuances of that question correct, but please let me know if I didn't and we need to cover as well.
Can I add to that too, Michelle? So just so that everybody knows, so we are working with GS1 Australia, obviously on the what data does come across from the National Product Catalogue. So if that question is also covering ensuring what information flows from the MPCs into the UDI database, it's certainly working closely with GS1 to make sure that covers, and obviously what's in our data dictionary or what will be our final published data elements will reflect, will ensure the MPC passes that information through. So if the angle on that question was a bit more technical, happy to cover that as well.
Okay, and I think we'll do one last question and then we'll wrap up. Obviously, if there's questions in between, we'll address them at the next webinar as well and on our frequently asked questions on the website. So final question, what kind of communication protocol will be used to submit UDI data via machine to machine? AS2, AS4 or something different? So Gary, I might pass that one over to you.
Yeah, thanks, Michelle. So we actually have two methods that we sort of call effectively for electronic transfer of data over to the UDI database. So the first one, as I had just talked about, was working with GS1 Australia using the National Product Catalogue to have the information out of the National Product Catalogue transferred or accessible into the UDI database if a sponsor or manufacturer chooses to use that as an option. The other alternative is the machine-to-machine interface, which is using an API. It's a RESTful API. We are actually using the HL7, so Health Level 7 Structured Product Language, so HL7 SPL, as the format. So we're mirroring at the moment what the US FDA use for their data exchange, and essentially taking that same process. So the format that we're looking at matches the US FDA Good ID, and once we have the final take on the regulations and the data elements, we ensure that that messaging format or the messaging structure matches the data requirements that have been established as part of the regulatory requirements. But that's essentially the methods we're using at the moment. And I'll probably just take the chance to answer that, Michelle. We will be sending some more information out about that sort of machine-to-machine interface and using an API gateway to be able to establish those connections to a range of people. So if you haven't if you're asking that question, you haven't registered or you haven't, and you'd like to have machine-to-machine access, let us know through the email to the UDI help desk, so udi@health.gov.au. Good timing to get in. Thank you.